How many gorgeouses can Glenn work in one forecast? I love it.
That was a lot.
4 gorgeouses. All right, now time to answer some common medical questions. Joining us is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you for being here so
You're
much.
welcome. Good to see you.
Well, it's an adult problem, at least we think, high blood pressure, but can a child have it?
Yeah, unfortunately, we see it, and we're seeing it a lot more. Part of the reason is because of the childhood obesity phenomena we're seeing, sedentary lifestyle, and also just poor diets. Typically, though, it's secondary to another medical problem, kidney disease, congenital heart disease, but also genetic disorders as well. Now, it's real easy to diagnose. Blood pressure cuff, you check it 3 different times over the course of about 6 months to a year. The diastolic, which is the lower number, has to be greater than 95. If it is, your child has hypertension. Now, the medications are similar to those that we take as adults. Beta blockers, diuretics, calcium channel blockers, those are the same. But hands down, bottom line is we need to start with the basics, change their diet, lower their salt, have them lose some weight, and get out there and exercise, do some physical activity. Works better than any medication can.
Okay. Well, we typically think sweat is sweat. There's actually a commercial that says stress sweat smells different. So is it stinkier than regular sweat?
You know, our viewers come up with great questions.
They do.
There's actually 3 causes of sweat. There's sweat from physical activity, sweat from heat, and there's stress sweat. Now, the first 2 are because your body's trying to cool off. The sweat from heat and physical activity are different glands. They're actually from the apocrine glands, and they're typically watery. It's from the pores opening up and the body's trying to cool off. Sweat from stress is from a different gland, the eccrine gland, and that's mediated by hormones or cortisol. It's rich in nutrients, and so what happens is that sweat gets on your skin, and the bacteria on your skin just feed off of those nutrients, and then it stays on there, and it starts to be smelly. Not only that, it can actually be in more volume than sweat from heat or physical activity, up to 30 times more. So you not only get a lot more sweat, it's stinky sweat. So what do you do about it? Well, not a lot. Absolutely, there is some clinical strength antiperspirant, but the bottom line is, like we talked about in the past, stress management. Decrease your sweat if it becomes a problem. There are things that you can talk to your doctor about to help you manage that.
Okay, that's why they keep it so cool in the studio, so we won't get stressed out and stink up the joint.
Smell great.
We know. Thanks, Dr. Soria. And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, click on the health link, and then scroll down on the right-hand side, and that's where you will see the form to write in your question. Thank you once again for coming in.
You're welcome.
We'll see you next week, and
You
we'll
bet.
see you after the break.